Hi, I'm Dr. Paul Davidson. I'm a bariatric psychologist from Brigham and Women's Hospital and Harvard Medical School, and I'm here to answer your questions about weight loss. So I think the first step always is to recognize that there is a problem. If you're finding it's too difficult for you to be able to not do these kind of things, that you need assistance, acknowledgement is always the first step. And I think another piece that helps somebody suffering from any addictive behavior is to learn that you're not alone. There are others who are in that situation who are most likely very eager to try to help you. For many of you, especially if you're in a bariatric program, you may have mental health professionals, you may have dietitians, physician's assistants, and in addition to nurses or surgeons who might be available to help you out. Trust me, this is where some of us can do our very best work. And as I like to tell many of the patients that I work with, when you're finding that you're at your worst, we can often be at our best. And you should not feel shame in coming to talk to people about these things. Again, we see this as, just a challenge that we need to address head on. We're happy to help you with these kind of things. There are many 12-step programs available to help individuals who truly have addictions. Now, the most classic tends to be Alcoholics Anonymous, AA, or Narcotics Anonymous, NA, but we also have Overeaters Anonymous, for example, to help individuals dealing with what they feel are food addictions. There are also many support groups out there, and I would encourage you to draw on the power of the many. Oftentimes when somebody's dealing with addiction, they feel very alone with it. And one of the things that substance does, or whatever it is it helps them feel better. If you can create honest relationships with people who are interested in what you're going through, that takes away some of the need to do that. And those support groups can be related to food, they can be related to alcohol, to any kind of substance imaginable. And those groups tend to be free for the most part. When it comes to specific food issues, we have groups that are available online to individuals as well as those which are in person. I think you also need to realize that this is going to take time. There are going to be ups and downs throughout the course of dealing with any type of addiction. When things are going better, you find that you're able to kick it for a while, but then sometimes when a specific unexpected stress comes in, you may find that you revert back to it. Understand that it's a normal part of behavior. This is what we can anticipate. So don't beat yourself up and don't think all is lost. As I like to tell people, there's a very big difference between a lapse and a relapse. Lapses are very common, where we go back to an old form of behavior for a short time if something goes wrong, and that's to be expected. A relapse, though, is when we really are going back to that traditional pattern and getting back in trouble. So you have to be careful, and anytime you see that, that's when you definitely want to seek out a professional. Also, it's wise to try to think of unmet needs that might be driving some of this behavior. There's a need that's being filled by whatever that substance is, be it food, be it alcohol, be it a drug. It doesn't matter. There's something you're trying to help deal with or try to overcome. And so if you're willing to address that and talk about that, you have a much better chance of being able to overcome that addiction. I think it's important also to recognize that things come with a price oftentimes, and I'm a big, proponent of bariatric surgery, but even with that, there are some risks, especially with the gastric bypass. Has wonderful results in terms of weight loss and comorbidity reduction, but it comes with a price, which is an increased risk for specific addictions. In this case, primarily alcohol, but also we see an increase in opiate use after some of these surgeries. We're also starting to notice that this may be true on some level with these sleeves. So we have to be careful, and we caution people to recognize that your tolerance, especially for alcohol, is going to be significantly less when your stomach is much smaller, when things go through your gut much faster, they don't get broken down as quickly. They stay in your system a bit longer, and they're a higher concentration than you've ever felt in your life. So there's a biological response that's different after you have this kind of procedure. So I encourage everybody to be very careful about that. And I caution all of the patients I see not to drink alcohol at all for the first year. And then after that, to be very careful, because one drink if you have a bypass or sleeve, would probably be enough to put you above the legal limit to drive. It's shocking. And again, I strongly encourage people to engage those support people in your life when you're starting to face this so you do not feel alone. And again, that will increase your chance of success.